Now, government has recorded a decline in cases of new HIV infections, tuberculosis and malaria, with a prevalence of 78%, 5.6% and 6% respectively. In a bid to further scale down the infections, government has inked 6 global fund grants worth 59.7 billion shillings to support HIV, tuberculosis and malaria interventions, and also to strengthen the health systems at community levels. Here's that report.
The government has assured Kenyans of attaining universal health coverage by partnering with different stakeholders in order to. The Ministry of Health signed 6 global fund grants worth 59.7 billion shillings, an equivalent of $408 million, to support HIV, tuberculosis and malaria interventions for a period of 3 years.
We cannot talk about progress in health in Kenya without talking global fund. At this grant signing ceremony, we are pleased again that this partnership continues in line with the Sustainable Development Goals of people, peace, prosperity, and partnerships.
From the grant, $232.6 million, worth approximately 34 billion shillings, will be used in the procurement of HIV drugs, test kits, and other laboratory supplies. $72.9 million, approximately 10.6 billion shillings, will help in the fight against malaria, while 67. Equivalent of 9.9 billion shillings will ensure quality care and prevention of TB. The ministry has also set aside $34.6 million, approximately 5 billion shillings, to help strengthen health systems.
Partnership with Kenya started more than 20 years ago. And since then, as others have noted, we've signed $2 billion of grants in the fight against HIV, TB, malaria, COVID-19, and to strengthen systems for health. And these 6 new grants worth more than 400 million allow us to continue that fight for the next 3 years.
Speaking during the signing and commissioning of the new Kenya Medical Supply Chain Center, Principal Secretary for Public Health and Professional Standards Mary Modhoni lauded the decline recorded in new HIV infections, tuberculosis and malaria. 8%, 5.6% and 6% respectively.
We are distributing 15 million nets across the country. The distribution of the LLIN to communities has yielded tremendous progress in the fight against malaria, with a significant drop in malaria prevalence from 8% to around 6%. Therefore, we really want to thank.
The new fund will also support provision of quality services for all people with leprosy and lung diseases. Kasichana Masha, Prime Edition.